And welcome again to The Doctor Is In, brought to you by Bay Area Medical Center. And I'm Jim Callow, your host. And today, our guest is Dr. Edgar Massabni, who received his cardiology and interventional cardiology training at Thomas Jefferson University Hospital in Philadelphia, PA. He's been in practice since 2000. Dr. Massabni joined BAMC in 2008 and is the director of the Heart and Vascular Center and the Cardiac Cath Lab. He holds several board certifications, including internal medicine, cardiology, interventional cardiology, and endovascular medicine. Prior to joining BAMC, he was on the faculty at the Deborah Heart and Lung Center in New Jersey, one of the country's largest cardiovascular teaching institutions. Dr. Massabni has a special interest in peripheral arterial disease and the minimally invasive options available for treatment of that disease. So welcome to our program.
Thanks for having me.
First of all, let's define exactly what peripheral vascular disease is and just how common is it?
So peripheral vascular disease or peripheral arterial disease is essentially hardening of the arteries outside the heart. And that includes the arteries of the neck, the arteries of the legs, or any other arteries that supply other organs in the body. Commonly, the most commonly referred to would be the arteries of the legs. That's what we call peripheral arterial disease. Now, it's very common as we get older. It's a disease of the elderly, and its prevalence increases as we get older. Overall, if you take people over the age of 70, it's estimated to be between 15 to 20% of people have peripheral arterial disease.
Other than being over 70, or perhaps a little younger than that, who's at risk of getting peripheral arterial disease?
Right. So first of all, anybody who has had hardening of the arteries in other locations, whether it is the heart or the arteries of the neck, the carotid arteries, is at risk of developing PAD. Other risk factors are the traditional risk factors for heart disease. So we're talking diabetes, smoking, high blood pressure, high cholesterol, and also family history. It seems that for the arteries of the legs, the most important risk factors are the diabetes and smoking. They carry a lot more weight than the other risk factors.
All right, no surprise there. If we hear those factors about every disease we talk about, it seems. Is PAD a serious condition?
Well, certainly. I mean, when we see people who have PAD, if you take everybody who has PAD, there is a significant risk of a heart attack and stroke over time. So that's the number one risk that we worry about over time, because when you have PAD, you just essentially, it's a manifestation of hardening of the arteries other places in the body. So that's one of the major reasons we look for PAD and we try to treat it. But also, in addition to that, PAD puts the limb at risk. So that's what can lead, in extreme circumstances, to gangrene and even amputation.
Is sometimes PAD will show up before you have heart issues, or it could go either way?
So yes, occasionally PAD is diagnosed in people who have not had known heart disease. However, if you take people who have peripheral arterial disease, the majority of them will have plaque in other locations, but it doesn't mean that they have necessarily blockages, in the arteries of the heart or in the arteries of the brain, but they are at risk. So once we establish the diagnosis of PAD, then it becomes what we call a coronary artery disease risk equivalent, which means those patients have to be treated as aggressively as if they already have had heart disease, meaning they have to be on aspirin, the cholesterol has to be managed aggressively, and they have to change their lifestyle. So smoking is a big factor, treating diabetes, exercise, and so forth.
All right, Dr. Edgar Massabni is our guest today on The Doctor Is In, and we're talking about peripheral arterial disease. Let's talk about the symptoms.
So, here, again, when we look at patients who have PAD, it's important to know that about half of them do not have any significant symptoms. They don't present with complaining of any symptoms. That's why we screen for that. Many of them are detected when they see their doctor, and the doctor looks at their legs and the feet. They look like they are cold. They don't have good circulation. The pulses are not there, or not palpable. So about half of the patients don't complain of any symptoms. And then out of the remaining half, the most common symptoms are, feeling that the legs are giving out on them when they're doing their normal activities. And that usually presents as either cramping in the calves or in the thighs when somebody's walking or going up steps, or feeling that their legs are getting weak or fatigued. And obviously in extreme circumstances, when the circulation has gotten so poor that, they can start to develop ulcers that don't heal, for example, or their feet, start to look like they're turning blue or red, and that can be a sign of early gangrene.
All right. We don't want to get to that point.
Yes, absolutely.
For sure. How do you diagnose the disease for sure?
So the most common initial screening test is what we call the ABI, or ankle brachial index. And it's a very simple test that's done in the doctor's office. And it's essentially the ratio of the pressure at the ankle divided by the pressure in the arm. And that gives us an idea if there's any sign of poor circulation. So that's the initial screening test. Think about it that way. And then depending on that, other tests that, sometimes we order an ultrasound to take a look at the arteries, sometimes a CAT scan. And the gold standard test is what we call an angiogram, which is similar to the heart catheterization that we do, but instead of taking dye test of the arteries of the heart, we take a dye test of the arteries of the legs.
So is this something that my doctor might want to screen me for when I go in for my yearly visit?
Depending on the risk factors, and that also includes age, yes. People who, for example, if they are diabetic over the age of 40, or anybody over the age of 70, people who have had history of heart disease, people who have multiple risk factors, especially smoking, for example, it's recommended to screen for PAD.
Let's talk about the treatment options.
So the good thing that has happened over the last few years now, we understand a lot more about PAD than we did before. So we know that with aggressive management of the risk factors, including cholesterol, diabetes, smoking cessation, we can truly lower one's risk of a heart attack and stroke, and that's the top of our goal when we look at people who have PAD. In addition to that, we have a lot more options than we did in the past to reestablish the flow to the legs. In the past, the only treatment essentially that we had was major surgery. Now, many options are minimally invasive, similar to when the options that we have when we deal with the arteries of the heart. So we have balloons that we can open the arteries with balloons now. We have medicated balloons that deliver medications to the artery that keeps the artery, they keep the arteries open for a lot longer. Sometimes we use stents, and sometimes we use catheters called atherectomy, which is essentially catheters that extract the plaque from the arteries and help us open the arteries without a major surgery.
With a typical patient, are you going to find the problem at multiple locations, or is it usually one place in the leg?
That's a very good question. A lot of it depends on when the patient presents. That's why we have a high emphasis on screening now. If we detect the problem earlier, then we can, one, work very hard and be aggressive on the risk factors, and two, many times when we detect it early, it's usually limited to a certain location or one or two locations that can be treated a lot easier and with a much more limited and minimally invasive approach.
So once you've been diagnosed, what's your prognosis as far as the long term?
Well, with aggressive management, now for one, we've been able to reduce the one's risk of a heart attack and stroke and the mortality from that. And also, as we have become a lot better at minimally invasive procedures, the risk of amputation is starting to come down, and it's come down significantly in the last 5 years. A lot of it is due to the minimally invasive procedures that we can offer now.
All right. So once again, let's talk about what people should look for, what they might be showing that would be a cause for concern and reason to see your doctor.
So, like I said, about half of the people who have PAD don't really know that they have it. But if you're over the age of 50 and you've had any history of hardening of the arteries in any location, if you had plaque buildup in the carotid arteries or had carotid surgery, if you had a heart attack or had a stent in the heart, you should really be looking to screen for peripheral arterial disease. And you can tell your doctor, and your doctor, will look at your pulses, and if there is a concern, refer you to have an ankle brachial index, which is the first step in diagnosing that. And other symptoms that you can look for is, are you able to walk or go up the steps like you were before? And it's a good way to compare that is from year to year. Obviously, there are a lot of things that prevent us from walking, like joint pains and so forth. But the main symptoms from PAD is essentially cramps or weakening in the muscles in the legs. And just keep it in the back of your mind. If you feel that could be a sign that your legs and your muscles are not getting enough oxygen when you're walking.
All right. Well, it's good to hear that you've got a lot more options for treatments these days. I guess that's also the case in almost every area of medicine, that things have really changed in the last 5, 10, 15 years.
We sure do, yep.
All right. Well, if people would like to find out more about peripheral arterial disease, PAD, how could they reach you?
Well, at the Heart and Vascular Center at BAMC, we do offer all the diagnostic testing for PAD. As you know, we have interventional cardiology now at Bay Area for close to 15 years. We have state-of-the-art equipment, and we can offer most minimally invasive procedures right here at home. People can start at our website at bamc.org for information, or call us at the Heart Center for any questions, or to establish any appointment for evaluation.
We've got a new hospital coming. What's that going to do for your department?
We're very excited about the new hospital. Of course, it's going to improve the patient experience quite a bit. We do have, right now, state-of-the-art equipment. Our cath lab was just updated a little over a year ago, so all that will be moving to the new place. We're expanding the Heart and Vascular Center. It's going to include a truly all-inclusive experience where all the diagnostic testing will be in one location. All the cardiovascular providers will be in one location. Cardiac rehab will be in the same place. So it's going to be essentially an all-inclusive integrative center for heart and vascular disease.
All right. We'll look forward to that next summer. All right, I guess that's it for today on The Doctor Is In. We'd like to thank Dr. Edgar Massabni for being with us and talking about peripheral vascular disease and how they can help you out if that happens to be one of your issues. So, again, thanks for being with us.
Thank you.
And that is our Doctor's In program for today. It's brought to you by Bay Area Medical Center. I'm Jim Callow. Have a great day.